Hi, my name is Britt Spears. I'm a certified prosthetist orthotist and a fellow of the American Academy of Orthotists and Prosthetists. Today we're going to discuss compression therapy as well as compression garments. Compression therapy is very important in the early stages of healing during the amputation, post-operatively. Compression generally, if it is a well vascularized patient, will be started by utilizing a rigid dressing. This rigid dressing is a cast that on a below-knee amputee that extends from the very distal end up to the proximal third of the thigh. It is very hard and it helps prevent the edema from occurring. It also, besides stopping the edema, it gives a sterile healing environment, helps prevent flexion contractures, as well as protects the end of the residual limb. Once a patient has gone from a cast that has to stay on, then at night they are able to utilize a compressions type of garment. Usually at the very beginning stages, we prefer for the sutures, as whether they are stitches or they are staples, to stay in for 24 to 27 days. This will help maintain the integrity of the residual limb. However, while that is going on, if there are sutures, then you can, as a patient, utilize a compression sock such as this. This slides on the residual limb. It's got a little button that slides up to the very end, and then you will flip this back around on itself to where it's got the double compression. These are easily washed. These have elastic in them. Elastic, you never utilize chlorine bleach on it or put them out in the sun because it will ruin the elastic. You don't really want to put them in a dryer or a washing machine. You would utilize like a woolite or a very mild detergent soap and wash these items, and I would hang them up to dry. You should receive 2 of these. That way you could have one to wear and one to wash, and you can keep that up. There's other styles. If you have staples during the early stages, you would use an ace wrap. Notice this ace wrap has clips right here. We do not recommend utilizing clips as they may cut through onto the skin. This will be utilized in a figure-8 wrapping. I will not tell you how to put this on. This is something that your physical therapist or your prosthetist must show you how to do. And you can't really show somebody one time and expect them to do this. This is something that must be repeated over and over before you really would get that. Now another item is this is another form of a prosthetic shrinker. Notice it's got a line on there. Most of them have some form of a seam. You would want the seam on some of them. They go on the front. This style would go on the front of the residual limb. Some of them have a very thick seam and you would put it on the back of the limb. When you place it on, you're going to turn it inside out to start with, and then one person will pull it this way, the other person will pull it this way, pull it up to the end, and then turn it back on itself. This is elastic. As I've stated earlier, I gave you the way to take care of elastic items. All of these items, you should have a duplicate set to be able to place on there. That way you could have one to wash, one to wear. Here is an above-knee prosthetic shrinker. It's got a cutout. Notice this is lower. This area goes in the groin. It also has a belt that goes around the waist. The waist belt will wrap around and it's got elastic that will hold it on. This high side goes on the outside of the leg. This is elastic also, and you would maintain this the same exact way that you would do other elastic items. This is Britt Spears. Thank you. We will continue on with a further series.